here it is, finally, the self-myofascial release video to help the loved ones that cannot get up and down off of their chairs easily and safely. So I'm going to be moving the camera around, Scotty, so you can see exactly how to do this, and it's going to be a lot easier for you. Now, when we start doing the foam rolling itself, it's important that you give attention to how your patient is responding, specifically if they can't communicate very well. The first thing that we're going to do is we're going to start with the right leg, and we're going to start calf first. Go to the back side of the calf, and you're just going to start applying a little bit of pressure, and we're going to go around the entire calf. It's very important. You can do the whole side of the leg, but just avoid the shin bone. And you do not want to cross over any bones or joints. So if your loved one has any areas where they're really losing a lot of weight, be very gently over the fleshy part, but avoid the bony area. So we're just going to go, and you'll be able to feel how much pressure. It should be comfortable. We're going to go to the back of the leg. Now, all you're going to have to do to set up your patient is to just have them come to the very edge of the chair, because as we go around back, we're going to do the entire backside. This is going to be very beneficial for their mobility and healing. And now we're going to go to the thigh. Now remember, we're going to start at the top of the knee, and we're just going to go. And now let's go to the other side, obviously, because you know what they say, there's two legs to every story, or every roll. So myofascial release is very important to get the muscles to lay correctly, specifically if they're very tight and having a lot of flexibility issues. Those of you who have Parkinson's, it's very important because you suffer from tightening of the muscle and you start losing that limb swing, and this will help a lot. Not only with feeling better and mobility, it's also really important for the nervous system as well as circulation. So now we're going to go to the back, and I'm going to take you with me. Now you can see how far up Scotty is, so you want to make sure that you have enough space that you can get the foam roller. So I'm going to get you at the back. You're going to be able to reach between the body and the chair. And if your patient is very much limited in their mobility, it's very important that you set them up in a position firstly so they don't have to move around. So we're going to start at the top of the trap. And here's the shoulder blade. So we're going to work within this part right here, the muscular part. And then we're going to come up and down. So you want to find where the medial insertion is of the shoulder. And that's easy just by running your hand down, and you'll feel where the muscle actually attaches to the bone. So let's go. Go up gently on the side of the neck. Remember, avoid the spine, so you're not going to go directly to the back of the neck. And then we're going to come to that insertion point. Now we're going to fan down the shoulder blade. And now get behind. We're going to go on the left side of the spine. And you're going to see where the majority of the bulk of the spinal column is right here, the muscle. So we're going to go right down there. And then we're just going to fan over to the side. And then up by the armpit. Fan down again. And now we're going to repeat for the other side. The first session, when you introduce this to your loved one, it's important that you spend a little extra time, but not too much, because you do not want to overstimulate the nervous system. It can give flu-like symptoms, and it's just not comfortable. And it's a little scary if someone doesn't understand what's going on. So we just want to get the muscle to start laying correctly. Get the nervous system woken up. And then what I like to do at the very end is just go down the spine. So you'll be right over it. So the spine is depressed between the two erector spinae. come down to lower back and back up. Stopping at, you'll see where the spine is right here, that bone. Don't go past that because that could be uncomfortable on the neck. And then we're just gonna go to the side. Now, this is important to do before you start occupational therapy and after. If you have time for the most wonderful results and to help with mobility, flexibility, and just getting, like we've been talking about, the nervous system to start reacclimating to movement, do this in the morning. It's pretty fast. I did a lot of yapping to explain to you what's going on, so it's a lot quicker than what we're doing here. So you want to do it in the morning. Remember, have them seated safely, and then before your therapy video and after, and then once more before you go to bed. That would be optimal. But if there's not time for that, then you definitely want to do it before OPT and then after. All right. Now, when we progress to the standing part, when your patient is able to get up and you feel that they are safe and stable on their feet, we will go to a total body standing myofascial release before your occupational therapy and after. But until then, this is the one that you want to stick with. All right, enjoy.